fans. Today is a very important day. It's the OT opener. And here, over there, we have
Alicia Roberts from Hewlett, Wyoming.
And then over in that corner, we have
Nora Stevenson from Laconia, Minnesota.
It's going to be a great day today. You ready to play some tennis? On the court, we have Hannah with our tennis players. Over to you, Hannah.
Thanks, Brittany. I'm down here with Alicia Roberts. How are you feeling today?
Feeling really good. Pretty confident. It's going to be a walk in the park.
Nice. Well, best of luck to you.
Thanks.
I'm over here with Nora Stevenson. Tell me how you're feeling today.
Great.
Oh. Great. Well, best of luck to you.
It looks like Jacob's ready for a coin toss.
All right, ladies. Here's our standard quarter for the heads and the tails. Alicia, call it in the air.
Heads.
It's heads. It's your ball. Ready?
Alicia Roberts with the serve. There it goes. Nora with the hit. Nora's going for the hit. We got a great ball boy today. Look at that enthusiasm. Yes! Stay down!
Do you have tennis elbow? Do you have tennis elbow? Hey, do you have tennis elbow?
I don't know!
Call 911. We need an OT. Now I got tennis elbow too.
Suck it up. Meanwhile, in the waiting room. Oh, look, there's a baby in there.
Hi, are you Alicia? Yeah. Hi, Alicia. I'm Hannah. I'm going to be your occupational therapist. Mind if we go back to the exam room to get a closer look?
Sounds good.
All right, come on.
Ma'am, excuse me. What about my elbow?
Oh, you'll get your turn. What's the problem?
My elbow right here hurts really bad.
So when did you notice this pain?
Well, I was in the OT open, and I was playing tennis, and I went to hit the ball, and it immediately hurt.
Do you mind if I get a closer look? This
Sure.
sounds like a classic case of acute tennis elbow.
Acute tennis elbow happens immediately after an activity like a backhand shot in tennis with poor technique. Extensor muscles on the posterior side of the forearm are suddenly overloaded, causing micro tears on the tendon where it attaches to the elbow.
Ow! Oh, sorry. By straining your finger against resistance, I was able to see that the pain is localized where tennis elbow is commonly found. I could have used Mills maneuver or neural tension to test nerve tissue in the area, but it's pretty obvious we're dealing with tennis elbow here.
The Mills test is a more definite way to determine if the client has tennis elbow. As the client is standing, the therapist palpates the lateral epicondyle while passively pronating the forearm, flexing the wrist, and extending the elbow. If there is pain felt in the lateral elbow, the test is positive for tennis elbow. Using these tests will work, but performing an ultrasound scan or an MRI are the best tests to identify any tendon tears or inflammation.
What is tennis elbow?
Tennis elbow is overuse of the common extensor tendon, which is mainly the common attachment site for your extensor muscles of your forearm. We were able to discover this through Dr. Meyer's notes.
Thanks, Dr. Meyer.
Tennis elbow got its name because the backhand stroke in tennis requires strong extension of the wrist. However, tennis isn't the only way to obtain this injury.
Oh, I didn't see you guys there. I got this tennis elbow from hammering this play set.
I got tennis elbow from painting an extravagant picture.
Common symptoms include pain, tenderness, and swelling on the lateral epicondyle. This is where the damaged tendons connect to the bone. It is also possible for the pain to radiate into your upper or lower arm, including the hand and the wrist. Tennis elbow may cause the most pain when you lift something, grip an object, or make a fist, raise your hand, or straighten your wrist, for example.
I got tennis elbow from using my chainsaw inappropriately. I did this.
Okay, I think I understand what it is, but how do we fix it? I've got a serious tennis career to get back to.
To get back into your routine, we'll have you rest your arm and ice it for about 15 minutes a day. You should protect it by wearing an elbow brace and try to keep it elevated when you rest. The most important thing to do, though, is rest. I know this is going to be hard for you, but we don't want it to turn chronic.
Chronic tennis elbow develops over days or weeks and usually follows bouts of intense exercise/activity that the individual is not used to.
I have a couple examples of some exercises to get you back to your serious tennis career. What you can do is hold your arm out, grab the top of your hand and pull it towards yourself. This will stretch your extensors. Then you can flip it, pull your hand towards yourself again. This will stretch your flexors. Here's a fun one. Hang your arm off of the edge of a table and lift up this lightweight or a delicious Fanta and help it going on the way down. Do you have any questions?
No?
All right, let's get you back out there. Oh, sorry.
And we're back. We have Alicia Roberts back from her recovery from tennis elbow. She is ready to play. Okay. Notice Alicia is using proper technique by using both hands on her tennis racket, which she learned from her occupational therapist, Hannah.
Are we really going to do it on my face? Am I going to... Stop.
Calm down. Okay.
I can't do it.
My gosh! Alicia?
I tried really hard.
I've seen better tennis playing than a tampon commercial.
Nora, those are some pretty big boots you got there.
Chin up.
I'm tired.
And like, this is happening.
I'm hammering this play set.
Currently, hottest tennis ball today.
It's like Tarzan.
Keep holding it. Pause. Go.
Sorry, I said wait.
Is hold at the top of your hand and pull it towards yourself to stretch your flexors. Then you can flip it and pull it towards you.
Extensors.